Vitamin D functions as a pre-hormone with major roles in calcium and phosphate homeostasis. It's obtained from sun exposure and diet and then activated in the liver and kidneys. Beyond bone health, though, vitamin D receptors exist in immune cells, cardiovascular tissue, and in endocrine organs, highlighting its broad clinical impact. This next slide shows the chemical structure of vitamin D and its activation steps. Vitamin D2 and D3 share similar biologic activity, but D3 raises serum levels more reliably. Understanding the conversion pathway helps it in diagnosing deficiencies related to liver disease, kidney dysfunction, malabsorption, or enzyme defects. Here we see endocrine, paracrine, and intracrine actions of vitamin D. Immune modulation, cellular differentiation, and anti-inflammatory effects all depend on adequate vitamin D status. Clinically, this explains why deficiency is associated with increased infection risk, autoimmune disorders, and impaired bone mineralization. Vitamin D acts synergistically and systematically to increase calcium and phosphate absorption, but locally within tissues, it regulates cell growth, modulates immune responses, and influences gene transcription. These broader roles help explain the widespread symptoms that patients can experience with deficiency. This includes fatigue, bone pain, and even mood changes. When we assess vitamin D, we want to make sure we're using the correct vitamin D test. So to correctly test to evaluate vitamin D status, we use serum 25 hydroxy vitamin D. The active form 125 dihydroxy vitamin D fluctuates really quickly and may remain normal even in severe deficiency, especially in hyperparathyroidism. That's why 125D is not used for screening. 25OH or 25 hydroxy levels best reflect stores and overall status. So, who are some of the populations at highest risk for vitamin D deficiency? Obviously, someone who has a malabsorption syndrome, liver or kidney disease, limited sun exposure, or adults, older adults who may not have adequate skin turnover. Individuals with darker skin pigmentations. We remember all the way back from physiology the effects on latitude and vitamin D stores. Obesity and those on certain medications, even like anticonvulsants or even glucocorticoids. These patients often require routine monitoring and more aggressive supplementation. Guidelines recommend screening only those at risk, not universal population testing, although in the Pacific Northwest, most people would fit that not adequate sun exposure category. So we do see pretty bright or widespread testing here. Deficiency is defined at levels below 20. Insufficiency between 21 and 29, and treatment typically involves D3 supplementation with higher doses needed in malabsorption or obesity. Monitoring is really important here to avoid toxicity, especially in patients with granulomatous disease. So this is again providing further indications for a 25 hydroxy vitamin D measurement. These are more candidates for screening specific conditions as well as populations that we should make sure we're screening for vitamin D deficiency. Again, people obviously that have vitamin D disorders like rickets or osteomalacia, bone disorders like osteoporosis, issues with the kidney like chronic kidney disease, malabsorption syndromes, things like IBDs. So are Crohn's and ulcerative colitis, individuals who are on certain medications, patients who have granulomatous diseases, and really understanding who and when testing is needed really helps avoid overuse while ensuring high-risk patients are receiving appropriate care. There are some functional medicine targets to consider here with vitamin D intake and ideal vitamin D levels. Levels above 25 are preventing any overt deficiency, but some clinicians are aiming for a higher level, like between 36 to 40, or even higher, up to 50 or even greater. When we start getting concerned about toxicity is at levels above 150, but oftentimes patients can feel toxicity symptoms or symptoms of vitamin D toxicity around the 90 to 100 mark. So I tend to try to avoid getting up into I try to stay below 90 if possible for my patients on vitamin D, but that varies from person to person. So this includes kind of our baseline run through our initial hormone testing and screening. We're going to get into reproductive hormones next, as well as have a whole separate lecture on thyroid hormone management.